Dr. Lou, how does chiropractic care assist with sports injuries?
Sports injuries. Yeah, we do that every day here, especially this time of year. It's football season. Getting knocked down in any sport causes trauma to the spine, whether it's a whiplash type of trauma or it's just kind of a blunt injury or a twist. But falling from standing or falling from running causes a lot of trauma to the spine. And with young people especially, we just say, oh, just walk it off or put an ice pack on it and don't worry about it. But I could tell you this, all of the older patients that I have, people in their 30s, 40s, 50s, and beyond, we could pick out where these injuries are, especially ones that affect the alignment of the spine and the neck. And they're easy to see and predict how they've degenerated over time. And what we do is we go to the source again. I'm going to use that term all the time, the source. If there is a subluxation, if there is a misalignment in the pelvis, in the vertebra themselves, in the whole spinal column, it's easy to detect and takes a while to correct. We push the bones three-dimensionally back to center. But left alone, even as a young person, if a bone goes out of position, if it subluxates, whether it's the entire pelvis or just a vertebra in their neck, and it stays misaligned like that, it degenerates in that position and causes lots of problems later on in life. So one of the things I always advise my parents, if your kid gets knocked down pretty hard, the coaches are telling me terms like getting pancaked or getting submarined, and there's a lot of terms, especially in the football. It's time to, if your kid here's even better. If your kid gets knocked down and he's still sore in a couple of days, get him to a chiropractor. Get that corrected now while they're still growing so it doesn't become a bigger problem when they get older.